Hi everyone. So to continue what I was saying in my previous video, there is one other aspect where patients' safety might be important and health is important if they had some difficult delivery problems because if you are taking meds and if you feel you are okay, what can happen is after pregnancy sometimes if your husbands are too much involved in sex, it's a darker topic, but people don't want to address this topic usually with their providers. But in general, if they are wanting to indulge in sex after a few months of pregnancy, and if your body hasn't even healed even then, even if you take medicine, if you're just taking pain medicine just stops the pain actual healing in the body, and if they give you antibiotics they will stop you from getting infections. But other than that, any injury that you have in your body, which could have been due to cesarean or due to natural birth related causes, whatever is happening in your body, the healing that needs to happens majorly from the rest and food that you get and the nutrition quality of the food that you're getting. So, as a result, it is possible that when medicines are taken, we mask our pain so much by taking mood enhancers or by taking pain meds or both, such that externally we might feel very happy. Externally, because of the meds, we might feel our body is perfectly fine, but internally at the functional level, if our body is not fine, which is getting masked by the medications, then you will say yes to sex with your spouse when you shouldn't have, and then the repercussions of it, you might feel immediately, you might feel a few days later, but everything that is harming your health, weakening your health, causing infections, causing you to become susceptible to infections, causing you to deteriorate in health internally, emotionally, if you didn't have sex that was really the same as it was before pregnancy, all these will impact your sense of belonging to your spouse, sense of emotionally you will start again getting depressed or anxious because now that you experienced it, while experiencing it maybe you didn't say anything, but internally things will start festering. And then if a couple of times you did this because with medicine you feel okay, but internally all this damage is slowly structurally or functionally happening to you, which you're not realizing that every small instance of bad sex or painful sex adds to your plate as a mother, and then you become more stressed, more angry, more sad, more emotional because your husband is not understanding. And herein some men also need to start understanding that women sometimes can tolerate a lot of pain. Now the doctors who see women, they might understand it, and that's why they sometimes give you less meds. But sometimes if a doctor is also a new doctor, he may prescribe, say, there are two women who were pregnant at the same time, they are friends with each other, they went and saw two different doctors. One doctor was a younger recent graduated doctor, another is an older experienced 30-40 years doctor. Now the experienced doctor will be like, you can bear the pain and all these things that I posted in my previous video. He's of that paradigm that you allow the natural healing, you take as less medicine as possible so that it doesn't impact the baby. Whereas the new doctor, because he's a new doctor, many other medicines have come up ever since the other doctor has graduated. In US, most doctors do keep updated about new medicines that are coming up. But even then, if a doctor has a set paradigm where it has worked for his past patients, sometimes doctors also don't change their past paradigm of practice. Which, yes, if a doctor is unable to keep up with some at least modern relevant issues of women's health, then he's not as good a doctor as he should be. But if he wisely uses both the modern practices and his years of experience in the right manner, then he's the best kind of doctor to have. So trusting your doctor, building a good level of trust with your doctor, that's why is very important too. That's why if you're traveling person, say you're in a work profession where you need to travel to different cities, or your husband is working where you're traveling with your husband to different cities, that time you will not get quality care, because you are not seeing a doctor continuously in the same place. You're moving to say 2 3 different cities during the whole 9 months of your pregnancy, then can impact your health. That's why it's more better or safer and healthier for the woman and the baby if you have stayed in a particular area, seen a particular kind of doctor for a long time in regular checkups, to build that trust. And in the initial checkup time only, if you're not finding a trustworthy doctor, or if you're not able to build the right trust with the doctor, then you still have time in the later months to go to a doctor who will meet your needs. But we have to understand, we have also become a little selfish society. So if we are very selfishly driven or only ego driven person, sometimes, in the benefit that the doctor is trying to give us, if we don't see the benefit, sometimes some people can reject a good doctor also. Some women, the other women say, went to the younger doctor. She went because the younger doctor was giving her lots of pain medications for her pain, or was monitoring her depression during her pregnancy too. So she was taking meds for pregnancy related depression, whatever she was doing. Or she had gestational diabetes, so they were also giving her meds for diabetes. Now there is a natural body aligned way also to manage diabetes. There's also a medication oriented way. The person who's more aligned with their body, who understands how to manage diabetes without medicine, can even do gestational diabetes. I had a friend who did that. She had gestational diabetes when she got pregnant in her 30s. She did take some medicine when her insulin levels were really high, but she also tried to do the right diet control, get into the paradigm of eating the foods which will not increase her blood sugar levels. And also she included extra walks in her daily lifestyle. Before her pregnancy, she wasn't walking as regularly as she started walking while having diabetes in her pregnancy, taking half an hour walks after lunch, half an hour walks after dinner, so that her blood sugar doesn't get spiked up. While walking, her body uses up the excess glucose, and when she doesn't have a spike, she doesn't need insulin. She only needs insulin if her body's sugar levels were higher than normal. So that way she managed her diabetes. She also tried to do the control of sugary foods, because in her first pregnancy she did eat a lot of sugary foods. Her body was craving sugar. Now if she had, say, very emotionally supportive people around her, she wouldn't have craved this sugar. But because this is another thing that women undergo during pregnancy, after pregnancy, that emotionally if we are deprived, we are not getting the right love from our partners, or the right emotional support from our parents or guides or friends, then what happens is a secret silent stress is developing in your body, which is related to emotional needs. Because your emotional needs of nurturing and caretaking that you are doing to the baby is not fulfilled by someone in your life. Or even if they are fulfilling it, they are still not meeting the deeper need that you have, which can increase our cravings for sugary foods. So because her craving for sugary food was in her first pregnancy also higher, in the next pregnancy also it was higher. But now that she had the diabetes, now everyone will be like, oh, I have diabetes, I have to take medicine and I will stop it. That is a normal paradigm many people follow, which is okay. But if you do have the time, if you're a busy parent, if you're a busy spouse, your working life is also busy, you can manage your diabetes, gestational diabetes, with the medicine your doctor is giving. But there is always a secondary side effect consequence of any medication we take, both in our body and in the body of the baby that is developing in us. And the second aspect is, if you are if you want to become more health aligned, it's better to take medicine only as a recourse when normal things that can balance us, that can bring, like what she did with my friend's example. She used normal paradigms of exercise, diet control, nutrition, eating. Diet control meaning eating the foods which will give her the carbohydrates, but which will not give her the carbohydrates that raises her blood sugar. There is the low glycemic index, high glycemic index chart that you can follow. You can go to a nutritionist to help you. You can go to a doctor, or like an Ayurvedic doctor. They can also give you good nutritional guidelines. And now which my friend, when she was pregnant, these are the topics I'm talking about from 10-15 years back. In the latest history of humans, the additional thing that every human has to consider is pollution related factors. We have excess water pollution, excess air pollution, especially post COVID. People have to monitor this because though this has not yet come out, it is a important factor in everyone's health. During COVID, those patients, there are many people who got COVID and impacted by the coronavirus. But out of all the people who got impacted by the coronavirus, some people died, some people got severely hospitalized, some had moderate symptoms that they could manage by staying in homes. And in India, there were some hotels also, and other COVID recovery places were also set up where people could recover for the quarantine period. In other countries, people were just quarantining in their homes for a couple of weeks according to their guidelines of the country. Now, why is this quarantine there? The quarantine was there that you don't spread the virus to other people. But there is a secondary purpose also. During that quarantine, you're supposed to mindfully do things, understand what are the things impacting my health. If you're a mindful person, at that time, in those 2-3 weeks of quarantine also, you can observe, like, if I use this chemical, what is happening to my body. Like, if you're having a COVID like disease which is impacting your respiratory functions, impacting your cardiac functions, then there are other chemicals in our regular use of life that can also impact it. In WHO guidelines, that's why it said that you should have clean air inside the facility where patient is resting, and no chemical, less chemical exposure for the patient. What did that mean? That means, like, if you're living in a house like this in India and you're quarantining, or you're having breathing distress, but is this just a protocol for quarantining patients in COVID? No. Any patient who has respiratory functional health issues or cardiac health issues, they can also follow these protocols, because these are standard protocols for having good respiratory health. If I want a good respiratory system, I need clean air. If I want a good circulatory and cardiovascular system, again I need clean, pure, fresh air. If I am already damaged, my system is damaged because of COVID, or my system is damaged because there is a lot of pollution in the air, will both of the factors impact my health? Yes, because COVID is also running in your body, impacting your respiratory organs, cardiac organs, circulatory system, whatever organ damage that it is doing internally. Some of it is getting measured by a blood pressure monitor or a cardiac test or a lung function test. But many things are not getting found out immediately while your body is in the mid stage of deterioration. Because when you're in the mid phase of some damage happening, the most damaging things might show up in a test. Be it a blood test, be it a mechanical test using a device. But there are still damages going on. Even if your device shows that you are well, doesn't mean you are completely recovered, because if you are still feeling the same symptoms of tiredness, fatigue, breathing distress, despite no blood test showing that you have the coronavirus, what does it mean? It means that there are other factors still going on in your body, where some organ damages are still continuing in your body. It's just that it is not organ damage caused by the virus now. The virus has gone from your body. You have recovered from the virus. But there are other things in your lifestyle choices that could be impacting your health. And which is where I have talked in my previous videos also about earth pollution, where if we have pollutants, chemicals in our food, if we spray chemicals in our body for makeup purpose, hygiene purposes, if we buy clothes from a store where the store for hygiene purposes is spraying a lot of chemicals, all those chemicals are there in my clothes now, and when I wear that cloth, it will be in my body. If I wash that cloth from a store, because I know it has some dyes and other sprays that was done by the store or by the manufacturer, all those dyes and chemicals, if say I have washed it away in water after cleaning that cloth, now I am wearing it, there is still a secondary problem present if I have water pollution problem in my home. And most of the time, water pollution problems are not visible with your eyes very easily always. some water pollution problems, the pollutants in the water, because water is a very good solvent. So many chemicals can very easily dissolve in our water without us even seeing that chemical being there in the water. And if it is even, the chemical is there in very micro levels also. Daily when you're washing your clothes, daily when you are taking a bath, each micro quantity of that pollutant chemical in your water supply is eventually getting absorbed by you slowly. If we have watched the movie Erin Brockovich, there they were talking about water pollution problems from an industrial area that was contaminating their house water supply. But all water pollution doesn't simply come from industrial pollutants. Some water pollution comes from human activities, regular human activities of decades and centuries of humans using cosmetics, humans using toiletries, humans using, and all these scented toiletries, scented cosmetics, they are the most harmful to our body. And the scented detergents, those detergents that have these dyes and chemicals in them that will fix the chemical of the scent on your clothes. But along with fixing that scented chemical on your clothes, if you've used a detergent and a fabric softener that does that, all that heavy scent from that, it's stuck on your clothes. But means some chemicals are also stuck on your clothes, and those chemicals over time is harmful. One time I use a cloth which is washed in all these heavily scented chemicals, it's fine. Once or twice if I wear a body spray when I'm going out on a date with someone, that's fine. But if daily I'm doing it, daily I'm chemically spraying things on my body, applying things on my body which have high chances of all those chemicals from those products getting absorbed by us, because they are getting absorbed when you're spraying a perfume or a deodorant or a cologne, applying a cologne on your face, they're all getting absorbed by you. When you're applying a shampoo, it's getting absorbed. Body wash, it is getting absorbed. Partly it's absorbed, partly it's washed away. But whatever gets absorbed eventually, slowly, if multiple things like this have been absorbed by your body, multiple things have been breathed by your body, if air pollution is present in your area, these are also health impacting factors. And this brings me to the topic of the medical gaslighting with some cancer patients. Because what is cancer? Cancer is usually caused by exposure to some chemical, exposure to some environmental factors that are harming our health, and with long term exposure to those carcinogens, we end up getting cancer. So for example, we know that there are certain plastics that can cause cancer. That's why they have come up with plastics, the numbering that is there below any plastic bottle or plastic box that we use. If those numbers, or if it says in the packaging that this is a microwave safe plastic, you can microwave food using on those plastic containers. But if those containers aren't safe for heating food, what will happen is, if they don't have the safety number, or if they don't have any indication that these are microwave safe, if you're heating food using on those plastic plates or plastic containers, what is happening is, these plastics that are not microwave safe, they are not heat resistant. So as soon as heat is there on the plastic, some plastic gets leached into your food. Meaning how easily chemicals can dissolve in water, here the plastic is easily dissolving in the food you are heating in your if not dissolving, a gaseous substance is getting emitted when heat is applied to that plastic, and that gaseous or liquid aspect or some microparticles of that plastic essentially is getting into your food when you heat it in the microwave. And now if one time I eat a food from a plastic hot plastic plate, because this is also a problem in India, like I go to sometimes to the mall to eat food on the mall food court. Now in the mall food court, or even if I go to the restaurant, sometimes these restaurants for ease of, because plastics are so easily disposable in our modern lifestyle, there is a lot of plastic cutlery and plastic plates being used for serving hot food. Now in those food courts, when plastic is used for plastic plates and plastic cutlery is there, sorry about that, for serving our food. Same thing, these micro particles, like how I spit out, like that, when hot food is there in plastic, some micro particles are getting absorbed on our food, and that we are eating. Every time I'm eating, maybe I'm eating only this small dot of plastic one time I ate, but everywhere, if I'm eating using plastic containers, every time I am heating food in plastic containers, and a little bit of plastic gets accumulated in my from my food into my body, what will happen? Those plastics, being carcinogenic, will eventually impact my body function. It will coat somewhere, because plastic is a very coating like material, right? So a little micro amount of the plastic might be deposited on my cell somewhere, and my body doesn't know how to process it. That's why it keeps accumulating over there. If I'm not, say, a very exercise oriented person, then the chances of cancer are higher, because say some chemical is accumulating in my body, some plastic is accumulating in my body, there are some carcinogenic chemicals in my environment that I'm breathing, there's some plastic that I'm eating from my food. I'm not deliberately eating the plastic, but it is there in micro amounts. I can't see it, doesn't mean that it is not there. Some people can smell the plastic, which happens to me. Like those frozen vegetables that we get in India, I always get the plastic smell from frozen vegetables. So I don't prefer eating frozen vegetables in India, because there's a high plastic like smell. And why did I find this plastic smell more in Indian frozen vegetable than in an American frozen vegetable packet? Is because in India, if you have frozen peas that you have brought from the store, before they were given to the store, it is getting transported from somewhere. And if in those transport conditions, if say the cold storage fails, or wherever this thing was stored for a while before the peas were delivered, if that cold storage failed and there was a lot of heat in that area, what will happen is the plastic will start leaching. And maybe these are the plastics that they use for preserving these peas, whatever chemicals also they are using, maybe those chemicals are also very good leachers of plastic. So as a result, I get a very chemical smell in Indian frozen products. In US also I have got those chemical smells, but much lesser compared to India, because India is a warmer country. Where I used to live in Utah, only in the summers maybe I was getting this problem. In the winter time, because it's a cold place, less leaching of plastic is possible. But in a hot place like our country, more leaching of plastic happens because of the heat itself present in our environment in our country. So any tropical country will have this kind of plastic leaching problem. That's why more cancers are also developing in certain places if it is from heat related issues, because heat also plays a role in certain cancers developing. Now, why I brought up this topic about getting, say, contamination from water. Some chemicals might be there in our water which can be carcinogenic. Some chemicals might be there in our air which can be carcinogenic. Chemicals in our clothes can be carcinogenic. Even if nothing has been studied right now for any chemical we use, like the shampoo I'm using, or a face mask I'm using, or whatever I'm using in my daily life, which has been normalized as a consumer product, say I'm using it regularly. No studies right now show that these are harmful, because people haven't used it in enough amounts to know whether it is harmful. But say after 5 years you find out it is harmful. How did that data come up? When some data, like in Johnson & Johnson lotions related products and baby products, they found some carcinogenicity from Johnson & Johnson products in India, and there were some court cases also as a result of it. Now, for 5 years, 10 years, if you have been using that product and someone has used it on their babies or on their own body, from there that baby got cancer, and that's why you found out that this product is carcinogenic, right? But in that 5 years, the one baby who got cancer, does it mean that there are not other babies who would also not have got cancer or not have got some chemical harm from that same product? Right? There could have been other babies also who got cancer, but their mother was not observant. They didn't notice that using this product caused the cancer. That's why they didn't collect the data. The one who did observe and enough people had the same problem, leading to a observation that this product is causing cancer. But in the meantime, when the data is not emerged in those 5 years, when say someone had observed and found that other mothers had also had these same issues in the past, and like that, enough evidence was gathered to support this. Same way with the Erin Brockovich case also, initially people didn't correlate that water pollution problem was the culprit in all these different health issues of different people. But when they did find that water pollution was the problem in that movie, it is the same thing in our country too. Water pollution is present in India right now. Water pollution is present globally, because when I went to US from India, in the city where I used to live, I lived there for 13 years, but the initial few years of my stay used to cause my skin to be so dry and so itchy. At that time I didn't correlate anything to water pollution, but now, after many other personal experiences related to water pollution problems, I have finally concluded that my initial skin irritation when staying in that country was because of water pollution there, and my body was used to the water in India. That's why I did it. My body was easily able to get the skin irritation and dryness of the skin and all symptoms happening as a result of the water there. Same way, whatever chemical pollutants were there in the water was causing that for me. Same way over here in India, after having lived here in India again for the last 8 years, in the beginning few years when I had scalp problems, when I had skin problems, I didn't consider it was from water pollution. Now that I have realized it's from water pollution, I'm trying to be careful. But some days, if the water pollution is high, my skin looks really dull and bad and damaged, because my organ systems are partly damaged in some ways, and the damage is ongoing. Because if every day, every month, every year, for many years, some or chemical or the other is damaging my health slowly, while I go to a doctor, maybe all the symptoms will not show up in the report when I go to the doctor. Because what if that day and the day a patient is able to go to a doctor is always invariably a better day than the day when they were really sick, right? Because if you're having, say, because I am developing cancer, many of my symptoms were precancerous symptoms, and as a result, and from two different kinds of cancer, not one was a benign thing and one was a developing cancer. So because there were two things going wrong, and because multiple organs were impacted by the two things that were going wrong. And why were my multiple organs impacted? Because I'm getting this, the root cause was coming, one from radiation from the phone. I use phone a lot. I live by myself, so listening to music, doing many activities on phone, meditation practices, learning practices, educational videos, all these I do on my phone regularly. So a normal woman my age doesn't do these things, because they are not lonely, they are not alone, they have many families and friends to keep them occupied, so they might not be there on their phone all the time. But I am a woman. For the last 20 years of my life, I must have been one of the top women who uses phone the maximum without like the safety protocols for using phone. So I used to have low battery life phone and a heated up phone, and I would still use the phone because I had nothing else to do, nothing better to do. Now that when these thyroid problems started and many other things happened, which I've posted in my other videos, eventually I realized I was getting like radiation related inflammation. I had inflammation from other sources, from water pollution related problems, but that inflammation was escalated when I'm having radiation exposure. So the radiation exposure from phone or even from direct sunlight was causing my skin to feel like it's burning. As a result, what I did, now I'm mindful. If my phone is 70-80% charged or more, then only I use it. I try not to use it when it goes below 50%. I try to sometimes use headphones if I am going to use the phone while sleeping, because sometimes I used to put meditation music for hours in the night. Like I'm sleeping, the phone is on, but while before I went to sleep, it might have been 100% charged while it was turned on, and if I was not charging the phone, all the radiation in the phone builds up, especially when the phone is little less charged, right? So if you are getting radiation exposure related some cancer developing in your body, initially it will only show up as a benign symptom, or initially you might be feeling weak and fatigued, because I was weak, I was fatigued, I was tired, I was having breathing problems, I was having cardiac problems, my liver enzyme levels were high, there were many things, my blood reports were off, many things hinted to these cancer developing in my body. But until I reach the diagnostic stage where a doctor can tell, okay, you have cancer, does it mean that the cancer is not developing in my body? If I am feeling sick, if I am getting symptoms, if there is actually cancer causing elements present in my environment from water, phone, food, everything that can add to cancer, there are say 4-5 things that are causing my cancer to escalate or develop in the body. While the cancer is developing in a stage that the doctor can detect, I will still be sick. It's just that the doctor's measures for detecting the cancer hasn't caught up to my cancer developing in the body. But even if the doctor doesn't detect it, even if the doctor, and which is what happened to all these patients, they would go to a doctor and they had different, and because I'm a healthcare person, one day I will also do a video on what are the different hospital operations related stages where it fails for a patient. But from the patient's perspective, I'm telling you, like, if you got cancer and it took you a year or 6 months to actually get the diagnosis of cancer, sometimes it is because the reports are not showing that cancer visibly to the doctor. Like, say, the cancer is developing in my blood, but the doctor didn't test my blood for the cancer, they were tested only the nodules for cancer. Then this nodule is showing it is not cancerous, it is benign, but another cancer was developing in my body in the meantime, in my blood or in my bones. That cancer symptoms were showing in my report, but because 2 different cancers were going on, it was puzzling, and 2 different cancer symptoms were intermingled in my body. And not just cancer, I had other things also going on, so many other things were going on that was impacting my health and worsening my health. And me being a healthcare person, I understand if a doctor doesn't understand the severity of my symptom. But I, being a mindful person, I did meditations before I got this sickness. I was very self-aware. I had to be self-aware because in my family, I have lived by myself independently for many years. So the women who are single, the women who live independently, women whose family life was such that they had a very abusive childhood or abusive adult partner relationship, in all these cases, either because of the abuse itself, your body is already at a higher stressed out level, because of which your self-awareness level will be higher, or apart from as a consequence of those abuse, as a consequence of a neglectful partner, neglectful family life, what will happen is, some women like me, we are also doing meditation, we are also doing yoga, anything to balance our health and keep ourselves cheered up and our health at a higher level. So when you are doing all the things that you can do to keep your health at a higher level, at a better quality level, and even then you're falling sick, you know that something is wrong in your health, that's why you are sick. You've become more mindful. If I'm doing mindfulness meditation, my awareness of my body is more. So I know when my lungs are distressed, when my heart is distressed. Yes, maybe lung function test is not showing the distress. That means my lung is functioning optimally. But while my lung might be functioning optimally, if my cardiovascular system or circulatory system is impacted, that will also add to my breathing distress, which is not showing up as a respiratory malfunction in the lung function test report, but it is still a malfunction because it is causing distress. Another factor that impacted this lung function test itself is, I went to a hospital which has got good filtration system, HEPA filters. So the air filters there means that the air inside the hospital is pure, completely pure. It only has oxygen. Anywhere in that hospital, the air filters are working, they have pure air. Anywhere in the hospital, their air filters are not working or they are malfunctioning, they don't have pure air. But when the place where my lung function test was being done, they had good clean air. As a result, when I'm doing the test, if my respiratory distress is happening from air pollution particles, and it is not at a very highly escalated level of distress, I will pass the test, because as soon as my air is clear of all the particulate matter, all the chemicals, all the physical toxins, all the viral toxins, that whatever that filtration system is filtering out in the hospital, I am getting clean air, my lungs are now relaxed, and it is not going to show distress. But as soon as I step out of that hospital, I'm walking on the road, I'm driving on a vehicle, all the fumes from the vehicle, all the air pollution in the outside air immediately impacts my health. Immediately again I will start showing some symptoms of distress. Now this is why some women, when they're going to the doctor, they have breathing problem, they have cardiovascular problem, but that day when they went, especially when they are there in the ER, or in seeing a cardiologist, or seeing a internal medicine doctor, whoever you went to see because of your health issue, if in that hospital on the day you went to see the doctor everything shows normal, or even if they are abnormal, sometimes doctors will be like for me it happened, my heart rate was high, my heart rate was 140 150, but there is this which I have also learned when I was studying as part of a PharmD program that I had entered. I didn't finish that PharmD degree, but it was related to clinical analysis of a patient's history. In that first year of study in that program, I learned that when you go to a doctor, or when you go to a PharmD student for your health issues, you're supposed to give, there are supposed to be some parameters we have to explain about our health based on the questions the doctor asks us. Now in those parameters, we are taught only in that PharmD program that sometimes, if patients are very nervous, their heart rate might be high, or their blood pressure might be high if they're very anxious personality type, which is very true. But I am not that anxious personality type whose heart rate goes up because I see a doctor, because I have worked in healthcare. I don't have any anxiety meeting a doctor, I don't have any anxiety seeing a doctor, I don't have anxiety. I've worked inside a hospital, I've worked outside the hospital as well in healthcare in US. So if I am not intimidated by people outside my culture, you think I will be intimidated meeting doctors in my own culture, meeting people in my own culture? No. So I'm not intimidated by doctors. So when my heart rate was high, it was indeed high. But if they keep this belief system that some patients can have high heart rate, that's why it's not a malfunction, which is what happened. I tried to convince the technician who took my reading that, see, I understand that you might think like this, but it is not true. But I couldn't convince the doctor who saw me after that whatever measures were being shown by the reports that they took while I was waiting, and they saw, they couldn't see any anomaly in my health, so they let me go. But even though they let me go, even though I saw a couple of doctors after six months interval with different readings which were showing to me that my cancer is progressing, which were showing to me that my health is worsening from other health issues, even if the doctor doesn't believe it, I have the knowledge. That's why I have the knowledge as a patient. Second, I had to sit and read my reports to figure out what is going wrong with my body, because I didn't want to do this self-analysis before I went on a self-analysis journey. For 8-10 years, I wasn't even practicing as a pharmacist anywhere. So for almost 8-10 years, I had zero pharmacy knowledge entering my psyche. I was only focusing on mental health issues. I was only focusing on being balanced. I was only focusing on being relaxed, because I have a lot of stress and trauma from my personal life experiences that I'm still healing from. It's not easy to heal from abuse. It's not easy to heal from neglect. It's not easy to heal from many of the things that I'm healing from. But despite that, that's why I sound mostly calm most of the time, because I do these practices to help myself to keep my calm at the right level. Not that I don't have bad days, and not that I don't have days where my stress levels don't go high. But my stress levels, again, if someone hears me shouting at someone, they might think this person's stress level is from abuse, or she's the abusive one. Definitely true. But there is more to the story. I am also shouting because internally my body is in high stress levels that are showing up in my blood reports. But if the doctor is not capable of seeing the high stress levels showing up in my blood reports, I can't do anything about it. And which is where medical gaslighting for women happens, because women are more self-caring. Women do caretake their health more deeply than men do, because majority of the women have lived this life. They have some history of abuse, some history of neglect, some history of spouse not caretaking of women. Women empathetically take care of their children, empathetically take care of their spouses, empathetically, if they are the empathetic caretaking nature, those women are very careful and mindful about how they caretake their family, how they caretake or are careful of the emotions and other needs of their family. But opposite is sometimes not true for all women. If you have a spouse who's every need you are caretaking, but the spouse is like, oh, my wife gives me food, my wife, when I have a headache, she will give me a head massage, she'll bring me soup, whatever a spouse is doing, he is happy and enjoying it. But when it's the turn of the woman, how many women are there, I want to know, whose husbands, when they have periods, come and give them a stomach massage or give them a hot water bottle? Or what will they do if you are getting pain? If you have pain, take a medicine. If you have pain, go, and if you're crying, take a medicine. This is what they will do. Or, I don't want to hear your shouting, they will run away from the spouse and go on a tour with their friends, or go on a drinking binge journey with their friends. How many men actually, monthly a woman is falling sick, monthly her body's blood vessels are rupturing and she's bleeding a couple of liters of blood. Many women do that. But how many spouses help them when they are sick? They can't even help them with the pain. They can't even help listen to them. Some listen, some might help with the pain, but the bare minimum. Women have been existing on this bare minimum breadcrumbs of care. So if a woman, and I am that woman who bleeds like for 5 to 7 days in a week during my periods, and in those 5 or 3 days of major blood flow, I do like bleed out liters of blood and liters of blood cells or whatever is coming out. So my pain levels are high. And even though my pain levels are high, do you think I will go to a doctor after tolerating that high? And I used to take like maximum 1 ibuprofen tablet occasionally out of 10 in a year. If I'm getting 12 to 13 periods, out of those 13-14 periods in a year, on one day of 1 month I might take 1 ibuprofen, or every month also one pill I will take. That's it. That is the level of pain medication I have taken. One time I went to a dentist. The dentist gave me a medicine for hydrocodone related or some controlled substance medicine they had prescribed. I have forgotten the name. But these are standard prescription, hydrocodone, Percocet. These are the medicines the doctors prescribe to someone when they are going for a dental procedure. Now, having that pain threshold, I will not even ask. I don't need that pain medicine at all. I won't take it only. But because dentists are now very scared of patients or being sued by patients or whatever, dentists are one place where I had observed in Utah where they prescribe a lot of pain medicines very easily to the patient. And in these medical gaslighting videos of women, where women are saying that I am getting ruptured uterus and I got only a couple of small dose of a pain medicine and a simple pain medicine, not a controlled substance. Her husband who went to a dentist, or her husband who went to a vasectomy procedure, which is a minor procedure, micro procedure, they got more pain medicines. Why? More pain medicines, stronger pain medicines, opioid medications. These were what the complaints were of these women. But it is because men say that they are strong, and it is true, men are strong. Men's muscular power is strong. Men's power to, if a guy punches them, to withhold that pain is strong. But men also take medicines for every single thing that they can take medicines for. Some men, not all of them, some men do that. And if that man has asked the doctor for the medicine, or the doctor is such that I refuse to take the medicine, but even then the doctor is like, no, take the prescription and go in case you have the pain. So I had to take the prescription with me. Now this was the one instance where he gave me a prescription with a controlled substance. Otherwise, every other procedure I have done in the same place, I never got those prescriptions because they were not major procedures. And also, if say I had lived in that same state for another 10 years and had continued seeing this dentist, and I had aged in life and some severe root canaling or something was done. At that time, if they were giving me prescription, if I'm still a good patient with a good pain threshold, I would still refuse in the next visit if they gave me the prescription, because that time I regretted taking that prescription. I'm like, why am I carrying around this prescription? I don't want to carry around a prescription. So I would refuse it. I am a pharmacist, that's why I know all these things, but patients don't know it. And even if a doctor has prescribed to a husband and wife 2 different medicines, understand that they are 2 different doctors. So 2 different doctors give medicine based on their practice regimen, what they understand. The difference in prescribing can happen because one is a dentist, one is an obstetrician. The difference in prescribing can happen because one might be a younger doctor, one might be an older doctor. Difference in prescribing can also happen because dentists are like regularly just giving these prescriptions to the patients. They don't care, because for them dentists are, I think, sorry, I will not talk about this. Anyways, so main thing is, that was the trend I observed. Dentists and pain clinics very easily give a prescription pain medicine to anyone. But if you are actually a mindful doctor, you will understand that medicine doesn't resolve everything. Medicine only stops some symptoms, and the main resolution for majority of the patient happens with self-care of diet, nutrition, clean living, clean eating. And now, if you are wanting to be really mindful, start considering water pollution, air pollution, clothes pollution, pollution from the chemicals you use in your daily life, as also start mindfully observing if they impact your health, even in the minor scale. Eventually it can become a major thing, because like scented products for me were a problem when I was younger. Some scents used to give me headache, some scents used to make me feel drowsy. Some, if boyfriends were using some cologne or something, sometimes they used to even give me rage. I get really bad responses to these chemicals. So for me, what kind of a boyfriend or a husband would be nice? Who doesn't use these products? Or someone, if I tell them don't use these products, it's causing health harm, if they realize it, if they are mindful, if they are aligned in their intuitive reasoning as well as logical reasoning, they will understand you, empathize with you, stop doing something that is harmful to you. But if a man hasn't developed those skills, how much ever I tell them don't use this product, I'm getting headaches, my anger is coming out more, they're not observing it. What can I do? The only way is prevent from dating those people who are not understanding that I am having a health issue. Because can I live continuously exposed to a product which is giving me intense headache, or which is causing me sometimes a angry response, because my body can't take that anymore. That angry response is coming out not because it's chemically damaging something in my brain, and all I'm doing is I'm inhaling it from someone else having sprayed it on their skin. Imagine what it is doing to that person. That person may not be getting the headache, or that person might be ignoring their headache, but it is also, after being absorbed on their skin, it is also impacting their health problems. And that's why sometimes men have all these cerebral issues and all that. When we are getting these cerebral issues, those who are mindful, those who are self-aware, they easily detect when they have headache. They easily detect this product is giving me this headache, this product is doing this to me. But those who are not self-aware don't detect it easily. But eventual consequence lies in the future of that person having used a product for many years, or even someone else who's their partner having exposed via inhalation that same product. Or if you're having sex with that partner, you will also absorb it from their skin, right? So that's why sex can also play a role in whatever chemical exposures you are having on your body. It will impact the partner. If you're having sex, whatever chemicals they are using, that will get absorbed on you when you're having sex. And now if you're a nursing mother, even if you are keeping your hygiene clean, your body clean, maintaining a low toxin exposure on your body, you're doing it to your baby as well. But if your husband is continuously exposed to chemicals that are harmful for health, and he's not understanding that those chemicals can also get absorbed on you or on the baby, will they invariably, even if he denies it, will they stop getting absorbed on your skin if you have sex, or if you sleep in the same bed with the person, if the baby is sleeping in between you and you're hugging the baby, he's caretaking the baby? If there are chemicals on his clothes, it will get absorbed on the baby. If there are chemicals on your clothes, it will get absorbed by the baby. If there are chemicals on the bed sheet, they are also getting absorbed by the baby. If you sweat, if the husband used a lot of chemicals for his hair styling or cologne or whatever he uses, and that is still there in his body, sometimes when he is sweating while he's sleeping, that chemical is also getting absorbed on your bed sheet. And if that same baby, mothers sometimes sleep with the baby in between in the same bed, as there's two spouses, in between the two spouses the baby is sleeping. So I also want to address another thing in this video, which is the SIDS. In SIDS, this is what the children who have sudden infant death syndrome, one reason could be that whatever chemicals the baby was exposed to, that caused it to get this breathing distress related death. Because if that baby was, even if it is 5 months old baby, 1 month old baby, 10 days old baby, if there were enough chemicals in the environment of the baby, if it is a 10-day-old baby, the factors that cause the 10-day-old baby's death lies in some of the factors that were present in the life of the parents before the baby's birth. Because it is absorbing everything, whatever a mother absorbs from the father while having sex, whatever they are absorbing while not even having sex but sleeping on the same bed. If the bed sheet has water pollution related, some pollutants, chemicals from your detergent related pollutants, anything, if you bought a new bed sheet and it had dyes and chemicals in it which haven't washed away yet, all these dyes and chemicals, everything the mother is absorbing. And if the baby is inside the body of the mother, eventually from the mother's bloodstream it can go into the baby's bloodstream. So the baby is also slowly absorbing all the chemicals that the mother has got exposed to. If they are having sex, then the father's chemicals are also getting now mingled. Whichever chemicals got exchanged with the mother mingles and goes into the baby. And then after birth, if it is a 10-day baby that died from SIDS, you don't know what is the cause, because the cause is multiple factors. Sometimes you can't find out the cause of SIDS baby's death, because there are multiple chemicals that were there in the mother, multiple chemicals that were there in the father, in their lifestyle, all of which this poor baby was absorbing while it was inside in the mother's body. And then when it was outside, it was absorbing directly when it is lying on the same bed with scented chemicals, with perfumes, toiletries, whatever has been getting used by their parents, everything. The baby who's a tinier form, so while for me that chemical is giving me a headache, it's giving me a breathing distress, it's giving me anger issues, or it's causing skin allergy, skin irritation, for a baby who's like 10 times 20 times smaller in size and weight than me, imagine how much poisoning that level it is for that baby. So that poisoning will naturally cause many harms, including a respiratory failure or cardiac failure or organ damage. Because I heard a story of a girl whose baby died in 15 days after birth, and they found that the baby had viral infection, and they detected that the cause of the viral infection could be the baby's step grandfather who had kissed the baby. Now, it is true that the baby died from viral infection, but there were other causes also present in that death. It was not simply a viral infection, the baby also had multiple organ failure. And that exposure to the virus of the baby had happened only 2-3 hours before it got severely distressed and was taken to the hospital. And in that same story narration, the lady who had given her baby for a few hours of caretaking to the grandmother, the mother had gone shopping to buy some different diapers for the baby, because the baby was having some skin irritation issue from the diapers. Now this is where lies the crux of what was going on with the baby. As I said, with SIDS babies, when a SIDS baby is inside the body of the mother and outside the body, chemicals that the mother had been exposed to, and now after being outside, the chemicals the baby is getting exposed to, they are all impacting its health. So when I was mentioning my skin irritation problems, I was not getting just skin irritation from one chemical. I was getting it from multiple chemicals, and only by slowly step by step elimination I figured out all the different chemicals that have impacted my health, the chemicals that I know that I'm using daily. I also yet don't know all the chemicals that are present in my water supply. All I know is this water supply is contaminated, because when the water supply is not contaminated, my skin doesn't get irritated. I don't get skin irritation. But when the water supply is contaminated, and it's been contaminated for many days, and my body is irritated by many other chemicals in my food and other environmental conditions, my skin is highly in a very high reactive state, which is what happened to this baby. That baby that died, who was getting that diaper rash, that is the first symptom of its body already overloaded with many chemicals, exposures, which had happened prior to the pregnancy, when she was inside the body of the mother, prior to his birth also, his or her birth also. That child had because I don't remember the gender of the child, but that baby had skin irritation, because whatever multiple organ damages that developed in the body can't develop in a body within 3 hours of exposure to anything. Multiple organ failures means there were multiple things going wrong in its body, and most of the time those multiple organ failures can only develop slowly in a person's body. My skin irritation problem is the first stage of the organ damage being caused by the chemicals. Second stage was the breathing and cardiac problems. Third stage was, for me, this is how it went. For me, it was the skin problem, scalp problem, inflammation problem, allergy problem. My allergic responses went high, which is what happened to this baby. His allergic responses went high. He was already exposed to many chemicals that is probably also impacting his mother's health also right now. Currently, if she doesn't address it, she wouldn't know what went wrong with her baby. Because if she again in the future wants to have a baby, she needs to know what is the actual cause. The virus was the last cause. The virus did enter the baby's body. It was one of the last things that impacted its health. But before the virus entered the baby's body, if he had multiple organ failure, most of his organs were failing even before his birth, while he was inside the mother's tummy. And then after the 10-15 days he was outside the mother's body, on the environmental conditions of the hospital where he stayed, environmental conditions and pollutants of the home life, and the additional load that came from baby clothes, because baby clothes also have dyes, diapers have chemicals and dyes in them. So he just couldn't take it. There were too many things going wrong in his health already, right? And all these organ failures can't always be detected as soon as the baby is born. Sometimes the organ failure develops slowly. By the time it is in a detectable level, sometimes for some patients it's too late. So what is the safety mechanism any mother should do? That's why any mother, anyone who, as soon as you have skin irritation problem, you shouldn't think that you are getting organ damage. But if your skin irritation problem is persistent and going on for many years or many months, you should raise this awareness that your skin irritation could be happening from the products you're using. Skin irritation could be happening from the food you're eating, because that also impacts your allergies. Many ways your allergies are impacted. I'll do a video on allergies later, but I know this is a long video and I've given a lot of information here, but it is very important and crucial that we understand that nowadays people are not simply dying from bacteria or viruses. People are also dying from chemicals plus bacteria and viruses impacting our health. They both together jointly impact our health. And nowadays the balance of chemicals impacting our health and radiological substances impacting our health, environmental conditions impacting our health are more than simply a bacteria or virus. So I hope this will give you a pause and helping you understand certain things related to the topics I discussed. If you have any questions, please drop me a comment and I would like to then address your issues. I hope it was beneficial to you. Thank you.